Just a quick heads up before we start. On Sandwiched, we talk honestly about life, loss, and caregiving. That means conversations may touch on topics such as death and grief. We invite you to listen with care, and please do step away if you need to. Well, welcome today to another episode of Sandwiched. It's my pleasure to welcome Rose Hedges, who is going to be our guest today. Rose is a mom, Rose is a wife, she's a sister, she's a daughter, and by day, she's a nurse. And recently, she realized that she is actually a caregiver. So Rose, thank you so much for joining today and welcome to the show.
Yeah, it's my pleasure.
As we get started, I thought it would be great just to share a little bit more about your family, your work life and how you balance it all. And when was that moment when you first identified, oh my gosh, I'm now a caregiver?
Yeah, I don't know that I necessarily had the aha that I can point out, but I think that being a nurse and kind of a caregiver, I've always I always care for all the things. I would say there's probably more a moment in my life where I was able to recognize who am I for me versus I'm a wife, so therefore I am a wife for my husband or I'm a mom for my kids. But I think that's kind of what I felt like. And this sandwich concept really resonated with me. Listening to you speak recently, I was like, yeah, that kind of applies to me where I'm such a caregiver for all these other people, but then I'm also raising a young family and all of that. So a little
Yeah,
bit.
definitely. And it's funny that you called that out, and I have to be super mindful of this because we probably should clarify at least obviously you're a caregiver by day. That's your profession as a nurse, right? And you're also a family caregiver. As you're thinking about that, are there any distinctions between the two of those that kind of come to mind for you personally?
Yeah, I mean, there's a professional and a personal role. I think that the boundaries of where does your professional role stop and your personal role take over when it's a family member kind of gets a little muddled and fuzzy a little bit. So yeah, I would say what is different is trying to remind myself to put on my personal hat. I am your family member versus your nurse. And how can I make sure that other team members, like when I have that family member hat on, treat me as such and not as a nurse who well, she's going to know because she's a nurse. Please don't ever do that if you are a person in healthcare. Just assume they know nothing and tell them all the things.
So, Rose, if you wouldn't mind sharing, tell us about the family member that you have been helping to support and navigate their own journey, kind of with as a family caregiver.
Yeah, happy to do so. So I think that I didn't realize that I was really filling this role for my family member until they reached out to me, and it started with, I think I need to go to the doctor. And it was like a Sunday morning, and it's very uncommon for them to reach out anyway. I said to my husband, I said, he must be really sick. I'm going to drive the hour away and go pick him up and take him to an urgent care. And I got to his apartment and I texted him, I was like, hey, I'm here. And he comes out and he looked like death. And I was like, oh, this is not going to end well. What is this going to be? He was very adamant. He did not want to go to the ER right away, though my ICU nurse brain was like, you need to go to the ER. So we went to an urgent care and his oxygen was like 85. And I was like, will you listen now? Yes, we'll listen. And that day just transposed really, really rapidly. We ended up going to the ER and I was filling that family member role, but then also I have the knowledge of really clinically what's going on with him at the time. He was actually flown to a higher level of care that day, had a lot of stuff going on, actually with his liver. And I think the thing that's wildly crazy to me, he's never drank a day in his life, just always very by the book. I would like to, his liver was really, really sick. We didn't know why, which was causing some other problems in his systemic area. And so he was having some bleeding in areas he shouldn't have, and he was just super weak. Ended up flying to a higher level of care and spent actually 2 weeks intubated. And during that 2 weeks, I felt so very pulled, this family member invested their life with me. They reached out to me for help. Why me? Was it because I'm a nurse? Was it because we have a good relationship? So then I felt obligated to, how do I be present for you while you're 2 weeks in a coma?
Yeah.
So that's really what started. And that was kind of back in 2019. And I just felt so very obligated, but then also the want to fill that role as a caregiver. And that's kind of what started the ball for us. And it's been many years of figuring out healthcare from a different perspective that I didn't even really knew was so complex.
Yeah. It's interesting as you were talking, it really made me think about some of my own experiences and other stories that I've heard. Have you had conversations now? It sounds like it's about, 6 or 7 years later, right? Have you had conversations about, kind of the why me? Like, what was kind of the reasons why you felt
Um,
comfortable or decided to reach out to you?
Yeah. In a roundabout way, yes. This individual didn't really have other support systems in place. Single, lives independent, no children, never married. Parents aren't really in the picture as far as like that kind of support. And I think I'm just kind of the person that's always like, oh, hey, how's it going? How are things been going with you? Just even a simple text can be impactful to people. And so I kind of try to fill that with people who are in my circle. And I think that's kind of where it came from. I did ask the question, why did you wait so long? Of course. Why did you wait so long? And it was, I didn't want to burden you. And I think that hearing those words from him was like, wow, you also care very much about me, but then also trusted me to make sure that I would get you the help that you needed.
It's interesting how you talked about really having to, it sounds like, almost redefine what caregiving is like and also what the healthcare journey is like. You spent a career in healthcare as someone who is delivering care, and then
Mhm.
now you were in the system trying to navigate for someone in your circle. Like, what was that even like?
Frustrating. So very frustrating and almost embarrassing at points because you want to lean into, like, I'm a very proud nurse. I'm proud of our profession. Nurses are great. Like, I'm very proud and feel honored that I get to be a nurse. And being at the bedside and trying not to critique somebody because you don't know what their day is going like. You don't know that maybe their patient next door is actively dying and now they're just trying to like do the bare minimum to get back to this other, you don't know what's going on, but trying to have those thoughts in your head, but like, oh, you shouldn't have done it that way, or oh, that's a little risky. Like that was really hard to silence for me because I am not like a perfectionist nurse. I am not like any of that. Like I give all the grace to the people that need grace, but it's really hard when it's somebody that is in your circle and you really like you love everything like about this, like being able to be that person for them. It's hard to pause and be like, well, it's not like the wrong way. It's just different than what you would do. It's hard to not like swoop in and want to save the day. So I think I felt that way being on the other side at the bedside. And then also the pace at which healthcare moves, which it sounds like maybe you've experienced this as well. Things are just so wildly slow. And the amount of hoops that you have to go through to get the services or the things that you need is wild. And I kind of felt like, well, I'm a nurse. I work in a hospital. I should know how to do this. Why don't I know how to do this? And it almost felt almost kind of like a failure at some points.
Well, one, I understand the feeling, and I can absolutely say you're not a failure. Having, I was in healthcare administration, and most of my career spent in pharmacy and then in hospital administration. So
Mhm.
that's where I spent a lot of my time. So it just is different on the other side, right? The forms and the paperwork and the metrics and all the things that we're trying to do to take care of patients and, run, everything at the same time. I think that I want to double click on what you shared about that you love your career and you're proud of
Mhm.
nurses. I am as well. I am not a nurse, but I have a very important nurse in my life, and they do a lot, especially folks who lived through COVID. Like that was just a whole other world, especially for nurses and healthcare workers. So I definitely wanted to, show gratitude for all the folks in the healthcare space, whatever the role is, right? But it's hard work, and it's also super important. So yeah, thank you. I mean, it is complex, and it probably also taught you too. I imagine that it's also probably changed even how you practice your career now, right? And how you interact with patients and patients' families now, having kind of being forced to be on the other side.
Yeah, absolutely. I would say it's impacted me in maybe some of the ways that I interact with different family members. I'm not really an assumer anyway, but I definitely call out, especially if I'm in like a mentorship role. Like, we can't assume this person is that their spouse, or we can't assume that this is their granddaughter, always going with an open mind. And who is this person with you today? How do they support you in your healthcare needs? Like, I took that definitely away because being in kind of like a periphery familial role, it was often assumed that I was his wife. I
Yeah.
was like the farthest thing from what I was. And so it was kind of like, I made note of it and I was like, I'm going to try not to do those kind of assumption things.
Yeah. Yeah, that's so interesting. And you're right. Like it's, we walk in, we see two people together. It's like, oh, they've got to be together, or that's a mom and daughter, or that's, whatever it is. We jump to conclusions and just, make assumptions. But I really liked how you talked about asking, oh, how's this person engaged in your healthcare? I think that's a
Yeah.
beautiful question. I really
Mhm.
like that.
Yeah.
So, been navigating this journey for a period of time.
Mhm.
Sounds like learning every day new things. Walk me through, how has this journey of caregiving, for your family member impacted your daily life? Thinking about your kids, your
Mhm.
husband, your
Yeah.
work, how is that impacting your day to day?
Um, I would say this life that I'm living today is not how I imagined my 40-year-old life to be. Yeah. Uh, it's not what I thought about when I was like, oh, I wonder what life will be like. Um, I would say, this family member lived with us for a while, and that was kind of taxing on my family life. Just there's a lot of like fear of like, what if they get really sick? Or, I was working in the ICU during COVID. What if I am the cause of something terrible and then maybe my children find them? There was also we have an extra adult living in our home, like not something my husband signed up for. Those thoughts kind of go through your head too, and that it made our relationship stronger, but definitely stressed at times, right? Because, it's not what you plan to do. And there's the financial impact of it, right? You want to, you just continue to provide and you don't quantify until maybe you pause and you look back, you're like, hmm, okay. That maybe things did add up a little bit there. I 100% would do it over again in a heartbeat. But looking back on it, yeah, it was definitely a chapter of my immediate family's life that where I was like, wow, that is, if you think about moments of your life, like, oh, I remember COVID or I remember graduating from college, like my kids are probably gonna be like, oh yeah, I remember when they lived with us growing up. It's a chapter.
Yeah, it is definitely a chapter. And as someone who, I'm 42 now, and it really is like, when you said it, I felt it. Like I felt it deep in my core. It's like, I don't know what I thought I was going to be doing or what I
Yeah.
expected, but this probably wasn't it in the best way,
Yeah.
and I appreciate that, it, it was different than expected maybe or anticipated, and that you leaned in and you did your best and that you can reflect on it in the best way. So I think that's all we can hope for, right? I feel like, at least for me, like as I go into my 40s more and more, that's kind of how I'm feeling life just actually works. It's almost like, oh, this is a nugget of information I wish I knew 20 years ago. But I
Yeah.
probably wouldn't have understood it even if someone had been like, this is what it's like. What surprised you most about family caregiving journey, even with someone who that's your career, right? You're a caregiver through work.
I think the thing that surprised me most was actually not about this family member. I was actually a caregiver prior to this. My mom was diagnosed with cancer super young, and I was a pretty big caregiver for her too. And I think that when I heard you say that, I reflected on how easy it was for me to set aside my own needs almost to a detrimental point. Like that was when I think about caregiving in the perspective outside of like the four walls of the hospital, and I say how easy for me, but maybe not in a good way, right? It was easy for me to set aside like, you should still eat. Of course I eat. I like to eat, but like you should eat healthily and not a bag of Doritos on the drive down to go see your mom. Like it
Yeah.
was easy for me to set aside all of that because nothing else in the world mattered at the time. And looking back on it, I might have done it a little bit differently, you know?
Yeah.
I think that's kind of the most surprising thing for me.
Yeah. I have heard this similar stories over and over, right? It's the self-care kind of goes to the wayside for a lot of folks. And I get it. Like these are huge, your mom with cancer, your other family member that called you on a Sunday and said, "Hey, I think I need your help," and you get there and you can tell it's not good. So I think that it's almost like all of my needs go away. And so it's how do we find the balance of even just micro moments of, okay, I'm going to take 5 minutes and I'm going to turn on some music that brings me joy. Or to your point, rather than a bag of Doritos, I'm going to run over to the cafeteria and scarf a sandwich, which is still not amazing, but maybe a little better than Doritos. Yeah. Yeah. Thank you. I'm curious with your mom's situation and also with your other family members, have you had to, kind of work with in, health insurance? I'm thinking about even Medicare, Medicaid, potentially disability. I mean, in this situation, it sounds like your family member was, out of work or not working. I mean, 2 weeks in the hospital, right? That's a lot of time.
Yes. Yes to all of those questions. So having to figure out, well, eventually lost his job. And then what does insurance look like? And because of his diagnosis and kind of prognosis, if you will, chronic but terminal, like this will be the diagnosis that eventually causes his death. So understanding that this is now a disability and that he's really unable to work, and you have multiple providers saying that, but where do you start to get disability paperwork at? So I was like, oh, I'm going to call a social worker. Well, what kind of social worker, Rose? And if they don't specialize in this kind of work, they're not going to have the answers you need. And what does that look like? And is it appropriate to have palliative care involved? And who, who and what can they do for you? And so now we need disability, but then we also need some kind of insurance. But because you're going to be disabled, you can have Medicare, but then you also can have Medicaid because you fall within this category of income. And you don't learn about that in nursing school. And I certainly wasn't learning about it in the ICU. I might have learned about it in a different area of nursing if that's where I was working, but I didn't. But it was just kind of assumed that, oh, Rose knows about this. She works in healthcare. That was the furthest thing from the truth.
Yeah. I'm curious. I mean, I think even just the identifying to talk to a social worker, I think that even some people need to realize have thought of that, right? And I think that really speaks to your level of expertise and experience in your profession. Who and what resources, like where did you go to even get started? I mean, you had an idea like social worker, but who? What were kind of some of the next steps you took?
Yeah, I actually leaned into my experiences knowing that palliative care is not hospice, and palliative care is actually super powerful because it's about goals of life and goals of care and like the quality of life you want to live. So I reached out to a friend and I was like, "Hey, this is the situation we're in. Do you think it's appropriate to maybe involve this team for simple even care coordination?" And I knew that there's teams of people that do this. So they said yes. And so we started with palliative care, and we primarily met with the social worker most, did some medication management stuff, but the social worker is really the person that was like, you have these options for like creating goals of care. Like, is it independent living again? Is it having somebody come in and check on them? What does that look like? And they were able to provide some connections, but then it was still kind of coordinated on us to let's set up these meetings to start the ball rolling. And it took well over 3 years to accomplish that.
3 years. Wow.
Yeah.
Can you share a time where you felt completely overwhelmed by this experience? And I guess I should have said, this all sounds very overwhelming. Is there something where I'm maybe thinking about this in some of my own experiences and other stories I've heard, but I feel like for a lot of us, we kind of come to a breaking point or really close to it. Is there an inciting moment that comes to mind?
It wasn't a failure, but I will call it a failure. My friends will tell you I didn't fail. With Medicaid, I'm probably getting language wrong, forgive me. Medicaid and whatever it is that we had finally gotten approval for, it's like a yearly or every 18-month reapproval thing. This girl didn't know that. And so it lapsed because this family member address was inaccurate in whatever system. And so the notifications were not going to the right place and their number had changed. So we didn't even know that we were supposed to be doing this reapplication. So we lost all of the things that we had worked so hard to get. And I was very overwhelmed at that time because he accesses healthcare a lot. So who's going to pay for this procedure? Who's going to pay for this visit and all of that stuff because we had just lost all of our benefits. There's not really a backdating of sorts. And I felt pretty responsible because I was supposed to know that information. I thought that I was supposed to know that information. I can look back on it now, but that
Yeah.
is definitely my like overwhelming breaking point of I can't I can't keep doing all of this without more support from like whatever services are in the community because there's things that I don't know that I
Yeah.
don't know. Hmm.
Absolutely. Well, while we're building a friendship, I hope, I will say you definitely did not fail. And I know that doesn't take away the discomfort and the feeling and also all the hard work, like all the hard work to get there. And I want to use this moment because obviously I try and stay as close as I can to changes that could impact folks, in our ecosystem. And I think that with Medicare and Medicaid right now, anybody that's maybe listening to this podcast, please, please, please make sure you follow the updates that are happening. I've heard some of the legislation, they're looking at renewals every 6 months versus 18. So I just wanted to call a little pause of just make sure you check the addresses and the text messages, things like that, because that can really, to your point, that can cause a lot of havoc and a lot of additional work. But absolutely, you are not a failure. And I'm so sorry that that happened. How long did it take to recertify or kind of get things turned back on?
I think it was like 2 months in before we realized that this had happened.
Okay.
So I think it was like 5 months before we like got everything all said and done and reactivated, if you will.
What a journey. I mean, I appreciate that you're smiling and that,
I can now.
probably not so much then. Yeah, absolutely. How has this impacted? I mean, it sounds like you had some young children at home in addition to your husband. Was there, impact in their lives? I mean, I think that, it could go one of two ways or multiple ways, right? It could be like, oh, wow, I get more time with this person. And, or also, too, like, oh, maybe now I'm sharing a room, or now my daily routines are now changed and disrupted.
Yeah, I think all of that. I think when I brought them home, there was no timeline.
Mm.
And we didn't discuss timeline at all because they needed help, we're gonna help. Okay, enough said. Okay, we all agreed, that's fine. My kids were 6. I have twins. They were 6, I think. The happy-go-lucky kids. Very lucky. And I think very much in the beginning, it was everybody was kind of cohesive. We all learned to do well together. But then to your point of some of the normal things that I do, like I'm gonna get coffee in my boxers.
Mm.
Well, that might have changed for my husband. I'm probably not going to do that anymore. Yeah, I'm not going to go out to the kitchen in my boxers. And the kids have they're really resilient. I think this family member though quickly realized that loud, obnoxious kids are just not their forte. So maybe a little bit different for them too. Kids are loud. They're just loud. They're
They got a
loud.
lot of energy, right?
They're loud. They leave their shoes in the hallway, all the things. And that's just not something that they really enjoyed either. So I think it was just as time went on, it was easy to see that there was friction, that it was time for the next step to happen, and we all kind of felt that way. It was just figuring out how to make that happen because on an income of just disability,
Yeah.
how do you get an apartment on your own? How do you make sure you have enough groceries? I don't know. It didn't seem possible to me at the time anyway.
Yeah. I'm curious, and this is a bit of a logistical question. You had shared earlier that this family member lived about an hour away when all of this
Mhm.
first started.
Yeah.
It sounds like didn't have maybe a whole lot of, folks in their circle that would have been able to help or even step in. Did they end up moving closer to you, or did they kind of go back?
Um, Stayed in my town that I live in. And this family member has I mean, we together collectively have a pretty large family, and they have another support person who just lived, like 3 or 4 hours away. That was also very active in their care. It's just because I was closer at the time, it was easier for me to fill kind of some of those roles. So that other family member definitely filled the gap of like my sounding board of like, hey, this is what's going on. And they were always offering like, they can come stay with me for a while and stuff. And very much appreciative, but just in the real like the reality of like we already have these scheduled appointments and everything's already kind of made, it just didn't make sense at the time. So they had other support, I think, available, but just at a further distance.
Yeah.
So when they did move out of my home, he still lives in the same town as me, so it's still he comes over on Tuesday and does laundry,
Oh,
like
nice.
I get to see
Yeah.
him.
Yeah. I anticipated, I've seen, that's kind of what I've experienced too, but I was curious. I'm wondering, coming from, you know, working in technology, spending a lot of time in healthcare,
Mhm.
have you found great tools or resources that, it sounds like you had someone who was kind of your sounding board and wanted to help. And I get logistically, it wasn't really feasible. Like someone who's 3 or 4 hours away to take someone to a
Yeah.
doctor's appointment, for example, probably, it could do it, but it's going to be that's a long day, right? What sorts of tools, resources, technology have you found, if any, that are trying to kind of help families and ecosystems around, folks who are struggling with either aging or even disability, to help them feel more supported?
I didn't find anything. I sucked it up and dealt with it, I think is what it was. Used my sounding board and using my support systems. And it was just a lot of like, okay, I have a little bit of a gain over here. Let's just keep clawing away at getting this one. But how impactful it could have been to have like I don't even know what I would have searched because I feel like I'm unique in that it's not an elderly parent.
Yeah.
It's just another family member who's chronically ill that needs some support. So I just Google chronically ill support. I don't even know. I think that's probably going to be a thing even going forward. How do you get notification to the right people that might need it?
Yeah.
It's going to be called.
Get the tools and resources in front of them, right, at the right moment. Yeah.
Yeah.
This episode of Sandwiched is brought to you by Tumbleweed. Tumbleweed is a purpose-driven platform helping families navigate aging, caregiving, and legacy planning with ease and compassion. Right now, the first 100 listeners to sign up will receive a free Tumbleweed membership for 1 full year. That's a value of over $100. But once those 100 spots are gone, they're gone. So don't delay. Go to tumbleweedplan.com. That's tumbleweed, plan, PLAN.com. Click Get Started, fill in your account details, and enter the promo code SANDWICHED. SANDWICHED. Thanks for listening. Now back to today's episode. One of the things that you had shared before we sat down together in another conversation was don't forget to help yourself. What does that mean to you today? Fast forward years later.
I try to put my feet in the dirt every day. I know that seems something simple, but it just helps me like ground myself. Um, I had mentioned earlier, like, who are you for you? It's so easy to show up and be the mom, be the caregiver, be the wife, be the friend, but really, who are you for you is to me, um, I like to be outside. I like to be in nature. I like flowers. I like to journal. Even if it's 5 minutes at the end of your day, you set it aside. It's so impactful. And it shouldn't be oh, I'll do that later. You should invest as much time in yourself as you are other people, or try to, because nobody else is going to do it, right? And I think that is just something that has really come out of the whole what my life is, like this journey I've had and pockets of where I've cared for different people. You got to remember to take care of yourself because when you don't, you can't take care of others really.
Yeah. What a beautiful statement. I mean, it's very simple, but it's so impactful. I just got to put my feet in the dirt every day. And I, as soon as you said it, I immediately felt grounded just in the words. I'm currently in the Midwest, but I spent a lot of time in California, and I always felt the same with my feet, especially in sand, like on the beach. Not much sand here in Iowa, but there's a little bit, right? It feels a little different. But what a beautiful sentiment. Thank you for sharing that. And I agree. We've got to make time for ourselves. I've been a caregiver. I got a family member who lives with mental illness, and something I was told for many years, and I'm good at it sometimes and not others, is a reminder of, just like on an airplane, when they're talking about if you're with a child or another person who's struggling to put on the oxygen mask, make sure you put on yours first, because in order to help the other person, you've got to be breathing so you can help them next. And so I try and remind myself, kind of the put on my mask first and then get the mask on for the person or persons that need help.
Yeah.
Not always great at it. And I think that we got to all remind each other about that, right? Hey, make sure you're taking that self-care and, get your toes in the sand or in the dirt.
Yeah, I think you just made me think of something that my husband says to me. He says that I'm a run to the fire girl, which I am. Like if there's a car accident, I'm out of the car and I'm going. Like this is what I do. But sometimes you have to pause and think that, okay, I've put out the fire, but now what? You have to allow yourself to think out, okay, yeah, you like to put out the fire and you're good at that. But then now what? You can't just drop it and let it roll away. It's what comes next. And sometimes forward thinking a little bit is a little helpful, I've noticed, because yeah, in the beginning, I'm sitting at your bedside in the ICU because this is what I do. This is the fire. I did not allow myself to think, well, what's next, really at all.
Yeah. It's a good reminder. I mean, I think that especially just from your approach and your personality and your career, like you're going to always be someone who runs towards the fire. And then after the fire's put out, okay, where are you at? Are you safe? Or is your sleeve on fire, right? Literally, it's kind of like, oh, wow, I didn't even notice that. And then kind of that, then looking forward. Yeah. So interesting. Was such a great point. What is one thing you wish people really understood about being a family caregiver?
I suppose you could, but there's no real walking away. It's not caregiving in the perspective of, yep, this isn't for me. I'm walking away now. It's not really an option. And most of the time when you're in a family caregiving role, you got yourself there because you're compassionate enough that you want to help. And it's not like you're ever just going to get to a point like, well, this is too much. Bye. It's just not what people do. I think that's one thing that I wish people would understand a little bit more because, well, if you don't want to do it, don't do it. That's just not reality. Like that phrase does not cross my mind. So maybe that's just something like for somebody who has not been in a family caregiving role, like you don't just walk away when times get tough. That's not what I do, I guess.
Yeah. And I feel like for me, I've heard similar comments, right? Oh, like you jump in too much or you're jumping into savior mode. And I know these are meant as a little bit of kindness, but also to a little bit of like, well, you kind of, you jumped in too fast. One is it's part of our personality and our approach. And is that really helpful in that moment? No. Like that's kind of my feeling. I'm like, I appreciate you want to help, but I think there might be something else. Maybe versus like, oh, like, well, you don't have to do it. Maybe it's just like, well, hey, is there anything I can do? I'm your best friend. Like, what can I do to help you? Next Tuesday, I don't even know how I'm going to get through the day. There's so many things, so many appointments, work. Would you be able to, pick up my kids and could you make them dinner so that they have a nice home cooked meal? Simple, just a simple ask. I'd be curious, like, how would that have resonated with you?
Yeah, that's amazing. Please go get the kids, play with them at the park. Yes. Um, mm-hmm. Yeah, I would even let you clean my kitchen because it's a disaster. But I would never ask you.
Yes. Oh, what a great point. I would let you, but I would never ask you. Well, I will happily the next time in your area. If you need help, I'll come in and I'll clean some dishes and scrub some countertops. I'll be there right there with you. Where I'd like for us to, as we're kind of, unfortunately, as our conversation is coming to a close, at least for now, would love for you to, think back to day one. And it sounds like you've had a couple of situations with family members where you've been a caregiver and a support system. what's something you would whisper in your ear as you're driving to visit the family member who called you on Sunday, not knowing what's ahead? What would you whisper in your ear as you're kind of walking through that door?
Be aware of how you show up. Be aware of how you show up for your loved ones. Be aware of how you show up as yourself in public when you're anxiety ridden and stressed out. Continue to maintain kindness, even though sometimes that might be hard, especially when adrenaline is high and stakes are scary. And give yourself grace when you feel like you fail, even though you're not really failing. It just might feel like that. Continue to show up for yourself too. But yeah, I think that's what I would whisper. Just be aware of how you're showing up. Who are you?
Yeah, be aware of how you're showing up. It reminded me of, one of the things you had mentioned earlier, which really stuck with me, is because this is your profession. You're a healthcare provider. And when you're in situations where you're like, ooh, the way they're doing this or the way they're doing that could have gone very different. And it sounds like, you really did try and take the approach of taking a step back and I don't know what's on their plate. And there are, 7 different ways to do this situation. And maybe I like the third way. And like maybe their way 5 is a little bit better or works for them.
Sure.
Yeah.
Well, that's hard.
It is hard. It is hard, 100% in anything, right? Caregiver by day or not, it is hard, 100%. That's part of being human. Like, it's just, we see all the time, like, oh, if you just did it this way, or, oh, if you just did that, I bet it would be so different. Maybe I shouldn't speak for others, but that's the way I feel sometimes. So I work very hard on like, oh, they're living life, they're doing their thing. Yeah. Well, Rose, this has been a real pleasure. I'm so grateful to your openness, your kindness, the gift you're giving to others, even just through this conversation. I feel like there's so many things that I learned and also that I wished I would have heard at different moments in time. So thank you for sharing and being vulnerable with all of us. Any parting words as we get ready to wrap up our conversation for now?
Go put your feet in the dirt.
Yes. Yes. My shoes are coming off in a couple of hours. I'm going to go put my feet out in the dirt. I love it. That's a beautiful sentiment. Thank you. All of our listeners, this was another episode of Sandwiched, powered by Tumbleweed. I'm so grateful that you've joined us today. To all of you out there who are sandwiched between life, family, work, pets, kids, caring for an aging person, or even just caring for a family member who may actually be younger than you and just need some help. We see you, we're here for you, and be sure to take time for yourself. Thank you for joining us. Sandwiched is a Second Act Studio production with support from Tumbleweed. We couldn't do this without the support of our production team, Maddie Willis, Brennan Plank, and our interns, Eileen O'Doherty and Anthony Cano. Thanks for listening, and remember, you are not alone. Have a great one.